Hi, this is Dr. Federo. I'm a board-certified plastic surgeon, and I'd like to talk a little bit in general about cosmetic surgery. So typically when someone comes in to talk about cosmetic surgery, there are three things that inevitably come up. Everyone is concerned about what are the risks of the procedure. Everybody wants to know what the recovery will be like, and what happens if, for some reason, they're unhappy with the result. So let's take a little time and talk about all three. In general, cosmetic surgery is very safe. It's important that anybody undergoing cosmetic surgery be a reasonable candidate for surgery. So the same rules apply for cosmetic surgery as any kind of functional or reconstructive surgery. So it's important that your plastic surgeon orders appropriate blood tests, EKG, chest x-ray, or gets clearance from your medical doctor. So you need to be in good shape to have cosmetic surgery, or you simply shouldn't have it. But for most people that are in good shape, the risks are very small and very reasonable. The risks vary with procedure, so you should discuss the specific risks for the procedure that you're having. Probably the most common question about any cosmetic procedure is, what is the recovery? And of course, the recovery depends on what you're having done. But in general, the recovery from most cosmetic procedures tends to be very reasonable in a few days to a few weeks out of work. And people can usually find that time. Unfortunately, there are times when people will have cosmetic surgery and they will be unhappy with the results. For the majority of cases, people are happy. People choose a procedure, the procedure is done well, patients are happy. But there is a chance that someone is unhappy with their final result, and we have TV shows devoted to this whole process. If you have a result that you're not satisfied with, what is your recourse? Well, often the surgeon that you saw will revise it or fix it at no charge. Typically there would be fees for OR and anesthesia, but most surgeons won't charge a revision fee. They want you to be happy. And in my practice, my policy is that I don't charge for revision surgery. The patients simply have to pay for the OR and anesthesia required. There are times when someone has a result that they don't like, and the relationship between the plastic surgeon and the patient has simply been broken. And in those cases, it's often best for that patient to see another surgeon. Not saying that that first surgeon couldn't fix it, but sometimes you just need fresh eyes and a new pair of hands to tackle the problem. One of my passions is rhinoplasty, and because I do a lot of primary rhinoplasty, and I have been doing it for 25 years, I see a lot of patients that are unhappy with rhinoplasty done elsewhere. So revision rhinoplasty is a big part of what I do in my practice. When I see patients to contemplate revision rhinoplasty, we have to talk about a whole lot of things. We have to talk about some of the things that we talk about with primary rhinoplasty, but there are unique problems that are created from already having surgery before. Typically, if someone had their nose done elsewhere and they're unhappy with the result, they're somewhat traumatized. And so they are concerned that they will never get the nose that they want. They had surgery by somebody else, they trusted that surgeon, and unfortunately it didn't work out. If you look at everybody that gets their nose done around the world, 15 to 25% will get redone. The operation is intrinsically hard. That's why it's important that you go to somebody that has a lot of experience for primary rhinoplasty, but you have to understand that even in the best hands, there is going to be somebody who's not completely satisfied with the result. So, when I see patients that are unhappy with their primary result, what I want to do is I start all over again with fresh eyes. And the first question is, what don't you like about your nose now? Not when you went to see the surgeon before, but what don't you like about your nose now? So in some ways, I get to start fresh. I didn't create the problem. I'm not emotionally attached to what happened before. I just want to make it right for the patient now. So we start again. What don't you like about your nose now? And they'll tell me specifically what they don't like. And then I will devise a plan to fix that. Now, doing revision rhinoplasty is different than primary rhinoplasty because somebody had their nose at a certain position, they had surgery, maybe multiple surgeries, maybe a trauma, and now they're at another position. So what I like to do is a little bit of forensic plastic surgery. I like to get all the information that I can before I go in. So if I can get the original pictures before the surgery, if I can get the operative notes from the other surgeon, and then just talk to the patient about what transpired through those years. So the goal is to find out where they started, what was done, what the result from that surgery, meaning their post-operative pictures, and where they are now. And often that will give me information as to how they healed, how they responded to the initial surgery, so I can make a new plan that will give them a better overall result. So revision rhinoplasty is very challenging, but it's something that I love to do, and I think that being a good revision rhinoplasty surgeon has made me a better primary rhinoplasty surgeon. It's allowed me to help more patients than ever.